suffer from urinary incontinence, you are at the risk of other health issues as well.
You have a chance to learn more and get some questions answered in an upcoming online chat to the Spectrum Health Medical Group.
Dr. Philip Hoekstra is here with us today, and a good place to start, I think, with this topic would be to explain how significant is a problem of urinary incontinence.
Well, urinary incontinence is a very significant problem, and it affects many more people than you might expect. Obviously, it's a much more common problem for women than it is for men, but it's equally devastating for both sexes.
Right.
And it becomes a more significant problem as people mature. It becomes more difficult to manage. The issue of urinary incontinence is the principal cause, the #1 diagnosis that leads to admission into nursing care facilities.
Really?
Wow.
Yeah.
Wow, I can see how that would be very difficult. Obviously, it's not something that all people talk about, so you don't realize how common it is. But it would really impede you from a lot of different things, like work and socializing.
Now, how many people are affected by this?
Well, it's estimated that in the United States, up to 17.5 million women annually struggle with urinary incontinence, and those estimates go up to as high as 29.5 million by some experts.
Wow.
When people come to talk to you, as they're going to get a chance this Wednesday, we'll get to that in just a minute, and what do they say of how their life is impacted by this problem?
Well, there's a lot of issues that are a consequence of urinary incontinence. I think one of the principal struggles is the issue of socialization.
Right.
People feel isolated. They feel that they don't want to participate in activities with family and friends.
Sure.
And it really devastates their lives.
Now, what can cause this?
Well, there's a variety of causes, and certainly issues are different for women than they are for men. For women, one of the principal causes of urinary incontinence is pregnancy.
Right.
Wow.
And on top of that, then multiple pregnancies becomes an even greater factor. For birth weights, the larger the baby, the greater the risk of urinary incontinence. And there's an interesting cutoff. It's about 9 pounds, 4 ounces.
Really?
Wow.
So if you're going to have a baby, try to have a smaller baby.
Try to stick with that. That's
Keep that in mind.
That as a mother of one and about to have another one, there's not a lot of talk about that, I feel, before, because it really changes your body after you have a natural birth. And that's one thing that a lot of people don't always think about. One change that may lead to a problem down the road.
It has a significant impact. It certainly does.
Now, how about for men?
For men, the main issue, the principal cause of urinary incontinence is prostate surgery, and specifically prostate surgery for cancer, radical prostatectomy. Fortunately, only a small percentage of men who've had surgery for prostate cancer struggle with urinary incontinence, but still a significant issue, a significant impact in their lives. Another factor would be scarring in the urine passageway, and that can be due to a variety of conditions, issues such as prior infection, injury to the urethra, trauma, or prior surgeries that have affected the urethra.
Right. I think a lot of people may have the impression that there's nothing they can do about this, but that's incorrect. There are some treatment options.
There are quite a number of treatment options that cover a broad range of management, and range from issues or from management conditions as simple as change in lifestyle through physical therapy, medications, surgical management, and we can go into that more if you'd like.
Yeah, absolutely.
Okay.
So
All right.
do you get to a point, I would assume that you go and see a doctor such as yourself to really diagnose what the best option would be?
Well, I think that's an essential factor, an essential element, and that is to make sure that you're getting the correct diagnosis, because there's so many different causes for urinary incontinence. And truth be told, there's no one treatment that is effective for all problems, for all causes. Each unique problem requires a specific treatment.
Wow.
For example, lifestyle changes that are relatively easy to do include things such as fluid management. For example, how much fluid do you think you should drink in 24 hours?
Well, they say often a certain amount of ounces, you know, that you have like a cup and what is that, 16 ounces or so?
Some yay high.
That's going to affect how often.
Most people will say, well, I'm supposed to drink 8 8-ounce glasses of fluids in 24 hours. Truth be told, most people are going to do just fine on about 6 8-ounce glasses of fluid. Many people, for reasons that may not be quite so valid, try to push fluids and drink an excessive amount of fluid.
Right.
This is one of the main factors that leads to problems of poor urine control.
Right, because you get told over and over again you should consume a lot of water, especially in times like this when it's hot.
Well, there are
It's
conditions
hot
where you
summer.
do need to drink more, certainly, but as a rule, that's 6 8-ounce glasses is about the right amount.
Really?
Avoidance of caffeine, which we all like. All right. It does play a very significant role. It stimulates the bladder to try to contract, empty itself out at times that you don't want it to, and contract more forcefully than would normally be the case, making it harder for you to hold your in.
So, if people have questions, how can they get in touch with you? Because there's an upcoming opportunity on Wednesday where they're going to get to talk to you.
That's right. That's right. On Wednesday at 12 noon, we're hosting a webinar, which is an opportunity for people to online submit questions that we'll review. It's done completely anonymously, so there's no mechanism of identification. So if you have issues with difficulties with incontinence, loved one, friends struggling with those problems, it's a great opportunity to submit questions. We'll review those questions. I'll respond to the questions personally, again, making sure that things remain anonymous. And it's a great opportunity for people to learn more about causes, treatment options, other conditions, other situations that they may have concerns about.
Wow.
Wonderful.
Well, I never knew anything about this, so I'm sure you educated a lot of people today by telling them, because I certainly didn't know. So.
And there are people dealing with it right now that are very interested because you're hitting home a subject close to a lot of people.
And we want to get the message out that people don't have to struggle with this condition. There are many treatment options that are available, options that can be very helpful, very effective, and ranging from things as simple as physical therapy through use of medication. There are procedural things we can do in an office setting, and certainly there are appropriate circumstances for surgical intervention as well. And surgery can be highly effective. It can correct problems of urinary incontinence in up to 95% of people or more.
Well, good to know. Wednesday at noon, a webinar with Dr. Hoekstra, Spectrum Health Medical Group. Thanks a lot for coming in today.
Thank you so
for having
much.
me.
Appreciate it. We'll be right back.
Are you West?